Hyperthyroidism, or an overactive thyroid, is when the thyroid gland produces too much hormone. These hormones regulate metabolism, heart rate, and body temperature. An overactive thyroid disrupts these functions, causing health issues. Also known as thyrotoxicosis, it affects people of all ages, especially women. Symptoms include rapid heartbeat, weight loss, and nervousness. Early detection and treatment are crucial for managing hyperthyroidism. Understanding hyperthyroidism helps in recognizing symptoms and seeking timely care. Hyperthyroidism can manifest in several forms, each with distinct characteristics and underlying causes. One of the most common types is primary hyperthyroidism, where the thyroid gland itself is the source of the excess hormone production. This can occur due to uncontrolled growth of the gland or autoimmune disorders that interfere with normal hormonal feedback mechanisms. Secondary hyperthyroidism, on the other hand, results from external stimulation of the thyroid gland. This typically involves the pituitary gland, which may produce an excess of thyroid-stimulating hormone, often due to a pituitary tumor. This overproduction prompts the thyroid to release more hormones, leading to hyperthyroidism. Tertiary hyperthyroidism is less common and involves the hypothalamus, the part of the brain that controls hormone production. It can occur when there is an overproduction of thyrotropin-releasing hormone, causing a cascade of hormonal activity that eventually leads to excessive thyroid hormone production. Another classification is based on the clinical presentation: overt hyperthyroidism and subclinical hyperthyroidism. Overt hyperthyroidism is identified by low levels of thyroid-stimulating hormone and high levels of thyroid hormones. In contrast, subclinical hyperthyroidism presents with low or undetectable thyroid-stimulating hormone levels, but normal thyroid hormone levels, often revealing milder symptoms. Understanding these types helps in tailoring treatment approaches and managing the disorder effectively. The causes of hyperthyroidism are diverse, reflecting the complexity of thyroid regulation. One of the most prevalent causes is Graves' disease, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, causing it to overproduce hormones. This condition is particularly common in Western countries and is a significant contributor to hyperthyroidism cases. Toxic multinodular goiter is another common cause, especially in older adults and areas with iodine deficiency. It involves the formation of nodules in the thyroid that produce excess hormones, independent of normal regulatory mechanisms. Similarly, a toxic adenoma refers to a single hyperfunctioning nodule that leads to hormone overproduction. Thyroiditis, or inflammation of the thyroid, can also lead to hyperthyroidism. This includes both subacute thyroiditis, which can follow a viral infection, and drug-induced thyroiditis, which is linked to certain medications like amiodarone and lithium. These conditions cause the thyroid to release stored hormones into the bloodstream, temporarily raising hormone levels. Excessive iodine intake, whether through diet or medication, can further trigger hyperthyroidism in susceptible individuals. Additionally, overuse of thyroid hormone medication, often as a treatment for hypothyroidism, can lead to excessive hormone levels. Understanding these causes is crucial for both prevention and effective treatment planning. Several risk factors can predispose individuals to develop hyperthyroidism. A notable risk factor is a family history of thyroid diseases, especially autoimmune conditions like Graves' disease. Genetics plays a significant role. Gender is another significant factor, with hyperthyroidism being more common in women. Hormonal changes, such as during pregnancy or menopause, may contribute. Age also plays a role, particularly after 60. Lifestyle choices and environmental factors can impact thyroid health. Smoking can exacerbate thyroid dysfunction. High iodine intake can increase the risk. Certain medications can negatively influence thyroid function. People with other autoimmune conditions have an elevated risk. Awareness and management of these risk factors can aid in prevention. Section 5. Diagnosis of hyperthyroidism. Diagnosing hyperthyroidism involves a combination of clinical evaluation and specialized tests to confirm the presence and extent of thyroid hormone imbalance. The process typically begins with a thorough medical history and physical examination. Physicians check for common symptoms such as an enlarged thyroid gland, rapid heartbeat, and unexplained weight loss. Blood tests are central to confirming a diagnosis of hyperthyroidism. The most common tests measure levels of thyroid hormones T4 and T3, and thyroid-stimulating hormone, or TSH. In cases of hyperthyroidism, TSH levels are usually low, while T4 and T3 levels are elevated. Additional tests such as thyroid antibody tests can help identify autoimmune conditions like Graves' disease. Imaging tests provide further insights into thyroid function and structure. A thyroid scan uses radioactive iodine to assess how well the thyroid is functioning and to detect nodules or growths. An ultrasound might be used to visualize the thyroid size and detect abnormalities in its shape or texture. The combination of these diagnostic tools allows healthcare providers to accurately diagnose hyperthyroidism and determine its underlying cause. Early and accurate diagnosis is essential for effective management, as it guides treatment decisions and helps prevent complications. Section 6. Symptoms of hyperthyroidism. The symptoms of hyperthyroidism can vary widely among individuals, but they generally reflect the accelerated metabolic processes caused by excess thyroid hormones. One of the hallmark symptoms is an increased heart rate, often described as palpitations or a rapid, irregular heartbeat. This can lead to feelings of anxiety or nervousness, exacerbating the stress experienced by individuals with the condition. Weight loss, despite an increased appetite, is another common symptom. The heightened metabolic rate causes the body to burn calories more quickly, leading to unintended weight loss. This is often accompanied by increased sweating and sensitivity to heat, as the body's temperature regulation is affected by the excess hormones. Other symptoms include tremors, particularly in the hands, which can affect daily activities and fine motor skills. Individuals may also experience changes in bowel habits, such as more frequent bowel movements or diarrhea. Fatigue and muscle weakness are also prevalent, despite the increased energy levels. This paradoxical combination can lead to significant lifestyle challenges. Recognizing these symptoms early is crucial for seeking medical advice and beginning appropriate treatment to manage the condition effectively. Section 7. Prevention and precautions for hyperthyroidism. While hyperthyroidism can't always be prevented, lifestyle adjustments can support thyroid health. A balanced diet rich in essential nutrients is crucial. Consuming adequate iodine is vital for thyroid function. Foods like fish, dairy and iodized salt help maintain levels. Selenium found in nuts and seeds supports thyroid health. Limiting processed foods and refined sugars helps maintain hormonal balance. Moderate consumption of cruciferous vegetables is advisable. Regular exercise and stress management support thyroid function. Avoiding smoking and managing weight are beneficial. Regular checkups are crucial, especially for those with risk factors. Adhering to prescribed medication and dietary recommendations is vital. Using eye drops for Graves' disease-related symptoms can alleviate discomfort. These measures can help manage hyperthyroidism and improve quality of life. Section 8. Managing hyperthyroidism, lifestyle and treatment. Managing hyperthyroidism requires a combination of medical treatment and lifestyle modifications to address symptoms and prevent complications. Medications like beta blockers and antithyroid drugs are commonly prescribed to control heart rate and reduce hormone production. These medications are often the first line of treatment and can provide significant symptom relief. In some cases, radioactive iodine therapy is used to shrink the thyroid gland and reduce hormone levels. This treatment is highly effective and commonly used in adults. Surgery may be considered in certain situations, particularly if medications and radioactive iodine are not suitable or effective. Thyroid surgery involves removing all or part of the gland and requires careful consideration and management. Lifestyle modifications play an essential role in managing hyperthyroidism. Regular exercise can help regulate metabolism and improve overall well-being. Stress management techniques such as mindfulness and meditation can alleviate anxiety and improve mental health. Dietary adjustments, as outlined in prevention strategies, continue to be important during treatment. Collaboration with healthcare providers ensures that treatment plans are tailored to individual needs, optimizing outcomes and enhancing quality of life. Section 9. Conclusion: the importance of early diagnosis and care. Hyperthyroidism, while challenging, is a manageable condition with the right combination of medical intervention and lifestyle adjustments. The importance of early diagnosis cannot be overstated, as it significantly influences the effectiveness of treatment and the prevention of complications. Regular monitoring and prompt treatment can mitigate the impact of symptoms on daily life. The role of healthcare professionals is crucial in guiding patients through diagnosis and treatment options, ensuring personalized care that addresses the unique aspects of their condition. Patient education is equally important, empowering individuals to take an active role in their health management. Understanding hyperthyroidism involves recognizing its myriad forms, causes, and symptoms. By being informed, individuals can seek timely medical advice and make informed decisions about their health. Preventive measures, coupled with effective management strategies, can greatly enhance the quality of life for those living with hyperthyroidism. Ultimately, the journey with hyperthyroidism is one of adaptation and proactive health management. With advances in medical science and a comprehensive approach, individuals can lead healthy and fulfilling lives despite the challenges presented by this condition.